welcome to this week. It's interesting because sort of once you get the result and then you're in this limbo land depending on how you feel about it, but you kind of go from week 5, 6, and then it's like week 6 to 12, you're just sort of tired and maybe there's nausea, maybe there's physical symptoms like bloating and tender breasts and feeling just absolutely wiped out. It's easy to kind of feel like the first trimester, this part of it sort of blurs together each week. Like, okay, what's unique about week 8? And that can, I suppose you could say that for the rest of the pregnancy, right? You just sort of live your life and days go by and then somehow you end up at 35 weeks, you know? But what I really am aiming to do with this series is to make each week sort of a special moment, a special reminder. And for me, week 8 is interesting because depending on your history, week 8, it could be week 7. Some people wait until week 12, but a lot of people will do a scan actually. This is something I didn't know was a thing in the US. But a lot of people will do a scan at week 8. And that can be if your doctor or midwife or you, most importantly, deem it to be worthwhile based on your history. And so for me, week 8, maybe week 9, maybe week 10, again, depends on your history, but we'll put it into week 8 for simplicity's sake. You might be seeing your baby on an ultrasound for the first time. Now, as with any choice in pregnancy, there are different schools of thought. Some people don't want any ultrasounds. Some people want tons of ultrasounds. You have to find what works for you based on you. I would say look into ultrasounds, look into every decision to whatever degree you feel compelled, but I would say, you want to know what's going in, on, around your body and how it might affect your baby. So, lots of women get ultrasounds, lots of women don't. I think already you can be tuning into your motherly, womanly intuition here. And it's just one of the many decisions to come. Some women might be doing NIPT genetic testing at this phase. I believe it starts somewhere around this time, 8-9 weeks. And again, so many decisions. And I think that's why people just go on with routine standard care, because it feels like there are so many decisions to make. But saying, what if I do nothing? Saying, let's wait and see. Saying, okay, give me the information and I'll research it. And actually doing that, I think, is worthwhile because this is your body. This is your baby. A medical provider of any sort doesn't have to deal with the ramifications of their advice. Now, they've seen lots of patients. They might have some great advice. I would point you again to the brain model, where you want to assess the benefits, the risks, the alternatives. Intuition and nothing. So again, what if you do nothing? You'll want to consider your options. And if your provider can't give you alternatives or speak to alternatives, that's a really big kind of red flag. I think most providers, whether it is a midwife or an OB, sort of has their thought or opinion on things. So, if you give them a list of different interventions, they'll say, okay, I support this. I think this is worthwhile. I think this isn't. That's okay to have a generic list like that, but then you want a nuanced answer based on the specifics of your scenario, right? Because you can have guidelines for anything. How to build a house, you can have guidelines, but I do think you need to have if you're an expert at something, if you've achieved mastery at something, you're able to you're able to see the situation holistically, understand the nuances. So you see the big picture, but then you can zoom in on, okay, well, but this person is whatever. It's this number of pregnancy for them, or this is their history. Here are their concerns. Here are the things that have worked for them so far. And you can put together a more individualized picture. And I mean, that's the whole case for midwifery or working with someone who is, I suppose, going to dedicate more time. So it's another thing. Do you go into an OB's office and get like 10 minutes and feel as though you're being rushed and you're just on a conveyor belt? Because also, not all OBs are the same. Not all offices with OBs are just churning women out. So if you're not getting a good feeling, that eye of the brain model, if you're not getting a good feeling about your provider, they don't have to be your provider. It doesn't matter. I mean, in network or in Canada, if you get a referral or whatever it is, like, that's not the end all be all. You can absolutely transfer. People transfer at 20 weeks, at 30 weeks. People do all kinds of things. I've had people whose best laid plans for a specific hospital and a specific OB, and they wanted a specific thing, doesn't work out. So, I mean, planning in this life journey of pregnancy can be tough. That being said, I think if you have preferences, you need to make them known, and you need to intentionally figure out what your preferences are rather than letting someone else tell you. Because if you let someone else tell you, whether that's well-meaning family, friends, or practitioners, you're not honing in on what I think, and I mean, this is just my opinion, but you're not honing in on what I think the pregnancy journey and becoming a mother really is, which is, and I mean, I'll have to report back on the mother part, but certainly the pregnancy part, I think, is coming to terms with this good girl societal construct of you've got to just be agreeable, and that innate internal bodily wisdom, intuition, the knowing that you can tune into that will give you an answer that's right for you. And when something feels off, it is off, and trusting that. And I've been in so many scenarios with different practitioners where there's been remorse after from my part, where it's like, oh, why did I let them, do that? Or why did I accept that intervention? Or why did I not ask a question, or slow it down, ask for time, like, again, just because you ask for time doesn't mean you're saying no. It just means you want to understand the implications of your decision, because this is the first you're hearing about that particular intervention, therapy, alternative, whatever. It's like, oh, that sounds interesting. Let me look into it and I'll get back to you, is a reasonable thing in the corporate world. Why is that not a reasonable thing when it comes to a medical procedure of any sort on your body or involving your baby? A good practitioner, just like a good salesperson or a good friend, is not going to make you feel pressured. The moment you feel pressured, something is off. Why is there an insistence unless it's an emergency scenario? If you're in a doctor's office, it's probably not an emergency scenario, or you would be carted off to emergency. And even in the emergency department, a lot of times things are not an emergency. Again, if it's truly an emergency, make the decisions that you can, or whoever is your authorized representative. This is not medical advice, and I am not telling you what to do by any means. This is purely my opinion. This is anecdotal and educational, but what I will say is, think about the pressure as motive. There's some kind of motive. When there's a scarcity, urgency question, if fear tactics are being used, that's not, in my books, a compelling reason to make a decision today, unless there's a true life or death emergency scenario in this exact moment. So, anyway, that's just a huge digression into advocating for yourself, and I feel strongly about this because of, again, my experiences. But if you're happy to go along with standard of care, then go along with standard of care. If you have, the point is to do what's aligned with you and not what anyone, including me, is telling you to do. And I think going through a traditional schooling system, working for an employer, we're very used to seeing what the protocol is, what the policy is, and following the steps and the rules because that's what's been laid out. Just because something's been laid out does not mean it's what's best for you. And so you've got to discern what's best for you and your kid. So anyhow, maybe you have an ultrasound, maybe it's a viability scan, and there's some reassurance there. By week 8, it's sort of this interesting threshold for some reason, at least in my experience. If you kind of make it to that 8-week gestation and there's a heartbeat, it's a good sign. Again, nothing is guaranteed in pregnancy, and so I think if you're doing things to look for certainty, I would look at that. I've certainly done it myself, and there is no certainty. So again, if you're making a decision out of fear or out of wanting some type of guarantee, I would just look into that further. Doesn't mean don't do it. Doesn't mean reassurance isn't a valid reason. If you want reassurance and that's what it gives you, then fantastic. If that works for you, absolutely great. Just know why you're doing something. Am I doing it out of fear? Am I doing it out of love? What am I going to do with the results? Like there's a lot of testing that goes on in the first trimester, or there can be. There's advised testing, let's say. And, what would I do with the result of this test? Is it going to alter my behavior in any way? If so, how? It's a good question that I like to ask because there are a lot of tests. And unless you think getting that result is going to alter your behavior in some way or your decision-making process in some way, what's the utility of the test? Again, just my 2 cents. But you are certainly blossoming. You are moving into that 3rd month soon. And so even though you've just found out the first trimester, you kind of get this month out of the 3 where it sort of happens, but you didn't even know it was happening because the first month is like that. And so now you're kind of really in the first trimester and probably hopeful for that 12-week mark. Again, being, I think, careful to glorify a particular date. I get it. I get milestones. It's really exciting, and be excited. And if that's how that feels for you, then great. If the milestones are making you feel awful, then I would look at the thinking process around, okay, look, today I'm pregnant. Today I'm 8 weeks. Today my body feels like this. Really coming back to just where am I at today? Because, is it easy to want to skip ahead to some phase? And I mean, even further on, right? It's like, okay, and I've said this before, but I think it warrants re-emphasis. Okay, when the baby's born, okay, the baby's born now. When the baby hits this milestone and that milestone, and it's just taking us away from being here now, knowing that this is the only moment we can truly relish and savor. We can be nostalgic about the past. We can worry about or vision about the future. Those 2 things are fun, but the most visceral experience of your life is going to be when you're ready to be in the present moment. And so the present moment is, if you're listening to this, maybe 8 weeks, fuller breasts, nausea, rounding of your lower abdomen, hormones in full effect, which might be bringing intense emotions. Vivid dreams might be on your radar. And those dreams link with that heightened sense of intuition that I have been sort of threading through this entire episode, which is tune into it, right? And that doesn't mean just say no to things to say no, but it also means don't say yes to things just to say yes and be agreeable. And it's the true, for me, one of the true exciting pillars of becoming a mother, and this whole hormonal, physical, spiritual, emotional journey that we're on, which is one of really deepened self-knowledge and hopefully a spiritual awakening of sorts. It's definitely a rite of passage in all cultures to become a mother and go from maiden to mother, and this is your transition period. And I mean, what a magical transition period. It's not like a 2-week thing. This is not a 6-week thing. This is like almost a full year of becoming, of growing, physically, emotionally, spiritually. 40 weeks, again, depending on your timeline. But, it's almost a year of maturing and growth. So we are aiming to really soak it all up and take it all in and learn these lessons, just as with any other, I suppose, project or endeavor that you embark upon. Okay, what's up with baby? Well, roughly size of a raspberry, 0.6 inches. Your baby is now officially called a fetus. So another special thing about week 8, a fetus, and perhaps that's where we also get the 8-week sort of dating scan or viability scan or whatever they want to call it. But that scan milestone, perhaps that's why. Fingers, toes, and eyelids are beginning to form, and the heart is beating strongly at around 150 to 170 beats per minute. Brain development is highly active, and spinal cord is growing. The almighty they, stress methylated folate at this phase, depending on if you have the MFTHR, hopefully I got that right, gene. Look into it. Folic acid is not as bioavailable. There's so much research being done in that space. Has a lot to do with spinal development. There, again, is a wide range of opinion around this. I think most people are agreeing at this point that methylated folate is the most bioavailable and useful. Actually, the best points to be taking it to decrease the chances of spina bifida and other spinal challenges are, it's about 5 weeks, like 4 or 5 weeks, so even just right as you're finding out, because it's the building blocks, and then, the whole first trimester, really, although some would say take your prenatal the whole time. Other people don't take a prenatal at all. So again, a variety of opinions. I think with any supplement, you really need to look into the individual ingredients. It is difficult to find a formulation that I feel good about. It's the same thing with baby formula. It's the same thing with all other supplements and vitamins and things. Really, to me, you're wanting bioavailability. So is it paired with other things that it needs to be absorbed properly? Are you taking it with the correct elements that help you to absorb it properly? Because, for example, vitamin D is a hormone, but if your magnesium is low, even if you're supplementing vitamin D, your body is going to have a tough time actually utilizing it. Again, depends on your school of thought. Going outside, sun on skin, best form of vitamin D. It's actually on your skin. Very interestingly, I had someone tell me that you shouldn't shower right after getting sun exposure because you wash it off, which is sort of interesting. It's like, wash it off. But I suppose, right, if it's in your sweat, if it's on your skin and you wash it, that those oils that perhaps have the vitamin D, which vitamin D, that's another thing, it usually comes with like K2, and you're going to want to take fat with it. And so that's just as very simplistic, like, okay, how does vitamin D interact with magnesium and K2? That's just like one example of all these different supplements that we take that, for example, iron and calcium, they don't normally put together. You really just, without going and getting a medical degree or like a supplement, nutrition, pharmaceutical degree, which sometimes I've had people, it's funny, I've had doctors in the emergency room or even just like, in offices and things like, oh, are you in the healthcare field? Like what work do you do? And I'm like, no, I just have like I've just spent a decade researching all of these things. I do find it interesting and I like to be informed. If it's like, okay, this is just, I don't want to research this, fair enough. But then be careful about who's influencing you, because it's really easy to, oh, well, this person just told me to take this prenatal, or this influencer takes this prenatal, or this company, is good. No company, I don't want to say not a single one, but there are very few companies where I would say every single product they have is a slam dunk. Like, there are clothing companies that I like most of their clothes, but let's say they're not all. organic or natural fibers. Like, it's tough to say. It's tough to put yourself in the hands of a company and say, I trust everything they do, So rather than doing that, I think it's important to just look at each product individually and make your choices based on your criteria: quality assurance, price, ingredients, sourcing, what's important to you, right? For me, I care about what's in a product. Do I make compromises at times? Yes. Is every company 100% aligned with me? No. Will I promote a company I'm not aligned with? Absolutely not. That's a hard line. But as I've become more intentional about my purchases, I've realized that, one, a lot of salespeople or representatives of companies actually don't know their product very well, which is a sad, sad thing. If they will not give you transparent information, there's a problem, because they should have information on sourcing or ingredients. Like, if you can't find an ingredient list on a product, what's going on, right? Why not? And then when we're talking about, in particular, pregnancy and specifically prenatals, you really want to look at bioavailability. People are actually coming out with food-based supplements now, which is interesting. Like, you eat a bar that has stuff in it, food-based supplements. Again, the best thing, and anybody you speak with, I think, if they're honest, will say food is the best form of getting proper nutrition, because, and minerals, vitamins, because if something's naturally occurring, then it comes with the components. Now, what you pair it with matters and can increase or decrease absorption, right? Like, as we've said, iron and calcium. Perhaps that's why some people don't eat meat and cheese or meat and dairy together. Which, how do you not like hamburger or cheeseburgers? I don't know. But anyway, just again to say, it's interesting. I don't really plan out the theme of these episodes ahead of time, but today this just seems to be all about really tuning into what's important to me, what's my intuition say, and being a thoughtful consumer, thoughtful patient, in your care setting, just advocating for yourself. And if something feels complicated, that doesn't mean you can't handle it, right? Sometimes I think ingredients or scientific sounding things can just be daunting. And so it's like, okay, whatever they say, I don't know, or I'm not good at this, or I don't know what this means. That's just a big sign to slow it down, in my opinion. It's like, okay, I don't know what this means. This feels big and complicated. I think people similarly do this with financials. I've definitely done it, at times where it's like, okay, this is just too complicated, so I'll defer to someone else, or I'll avoid this. And that's just not the answer, right? If you slow it down, that's the answer. If you can take time and write the stuff down, or look at it, put it in front of you, get it out of your head so that you can untangle it, I think that's the solution. And get some definitions, or look up some of these vitamins that you're like, okay, what is this? Because you'll feel more confident, and that will build that muscle of being able to self-advocate, because you'll know what you're talking about. And I mean, it's a vocabulary question, right? If someone's just throwing words at you that you don't know, it doesn't mean you're stupid. It just means that they have a vocabulary that you don't have, and you can learn a vocabulary. You can learn words, because at the end of the day, again, you are your biggest advocate for, again, yourself and your baby. So as you continue in this transformative week 8 with lots of things going on, I would ask you the question to consider this week, which is, how can you tune into your intuition? How can you tune into what's important to you so that you can trust that? Let's really get into what you think you want to do over the next few weeks. Again, at week 12, there are more tests and scans offered to you. Maybe you look ahead to that. Maybe you're already making decisions, as I said, with that week 8 scan, or you have one coming up. Maybe you're looking for a provider, haven't found a provider yet. Again, another opportunity to be conscious about who it is that you're interviewing for that very precious honor of being your support in this absolutely miraculous phase of your life. So, I mean, take that seriously, in a sense. Not like, let's make it serious, but more like, take your care, give your care the reverence that it deserves. Understand that you're worthwhile. You don't need to be on a conveyor belt and given 15 minutes and feel rushed. And, you know, like, there are lots of practitioners out there. Make sure that whether it's a prenatal or a practitioner or a certain intervention or something offered to you, whatever it is, just make sure that you, both from a logical and emotional standpoint, feel aligned with the course of action that you're taking. So I just want to thank you so much for being here. I'd love it if you shared how you're liking this series or what your cravings are or how you're feeling. It's such a kind of exciting, nerve-wracking time of a pregnancy, this first trimester, and I just hope you know that there's so many other people, so many other women in your place going through this, and if you do feel alone, that's okay. If you want to be alone in this, if you see this as sort of a solo journey, I get that, and I've done that for most of my pregnancy as well in many ways because of my own preferences. But if you are searching for someone to talk to, just know that I really am here. I really do want to talk about this. I mean, it's why I'm doing a series on it. So please reach out, email, DMs, connect with me on this, because I think it's one of, if not the most important rites of passage in a woman's life. So thank you so much for being here. I hope to see you at week 9, and take good care until then.